Hey guys, this is Dr. BT, and I just want to do a quick review of the hormones during pregnancy. So remember, estrogen, as soon as you get pregnant, it shoots straight up. At the time of delivery, it equates to about 90 birth control pills, so it is a lot. Secreted normally from the corpus luteum after conception in the ovary, and then when the placenta takes over around the 7th week, it starts putting out large volumes of estrogen. Helps the uterus develop and have a suitable place to live, and helps the breast and the ductal systems in preparation for lactation. So some of the discomforts from elevated pregnancy are nausea, vomiting, nasal stuffiness, tylism, which is excessive saliva spitting. They can get dehydrated. And epilepsy with those little hard nodules on their gums. Also, they can have inflamed gums, which is normal. Everything in their head swells. Intervention, small meals, educate mom on the risk for a DVT, because we know it's going to go straight up. Moms are really at huge risk for DVTs right after delivery, because at delivery it reaches its peak and then it falls. So we're looking at the result of that high amount of estrogen at delivery. Progesterone. Let me go back. So if you have a C-section, remember you have immobility and you have a surgery. So that really puts you at high risk. Progesterone, remember, was secreted by the corpus luteum to help us maintain the decidua until the placenta took over. It is the main hormone in preserving pregnancy. It helps the lobules of the breast in preparation for lactation, and it's a smooth muscle relaxant. So that's all over your body. That's your vessels, the walls of your vessels. Remember, Dr. Huggins talked about you have more volume in your vessels, but what happens is progesterone makes the vessels relax, and so the blood pressure doesn't go up. It just vasodilates every vessel in your body. Big ones here are nausea and vomiting, constipation, and breast tenderness. Also, you guys, when progesterone falls out, when the placenta falls out of your body, and that hormone dramatically plummets, that we really worry about psychiatric changes, because this one has the biggest to do with postpartum psychiatric changes. Nausea, vomiting, constipation. So, of course, nausea, vomiting, small meals, constipation, fiber, water, stool softener, breast tenderness, wear a bra. Don't eat late at night. They can use Tums of that. Human chorionic gonadotropin, secreted early by the trypoblast. And you guys, this one can have a little bit of nausea and vomiting as well. HPL, human placental lactogen. It's also known as human placental lactogen, or somatomamotropin. And you guys, this is secreted by the placenta. It makes mom insulin resistant, and so this is the cause for gestational diabetes. This is, remember, we check if they're really overweight, or they've already had sensitivity to type 2 diabetes. We go ahead and check them on entry to prenatal care, and then we check them again at 24 weeks. And we encourage them only eat 330 calories on average per day, so they don't have a lot of weight gain, and watch their blood sugars if they were on the verge of having diabetes. Relaxin, it's a true hormone of pregnancy, secreted by the placenta, relaxes all the ligaments. That's great because it relaxes your pelvic ligaments. However, you can get hip pain, back pain, and your feet are held together with ligaments, so you can have increased size of your feet. So don't stand on the feet for extended periods of time. That can cause mom to have more foot pain. And don't lift heavy weights, because you can injure a joint. And then prostaglandins are found in the female reproductive tract. We don't know exactly what their role is, but we think they start labor. And they are found in the semen of men. So this is why they say to have sex, if you want to go into labor. That's it for hormones.